Okay, donning and doffing PPEs, taking care of a COVID positive patient at the guidance center in our psychiatric unit. So you want to be in the nurse's station, you're going to put your PPE on there, and then you're going to go from there to take care of the person. You will have the supplies you need are the gowns, the fluid resistant, launderable gowns, gloves, your high-tech personal protective equipment storage unit with your shield and your N95 in it. So you're going to put all of the equipment on. You're going to use hand sanitizer first and make sure that your hands are fairly clean. Or you can wash them if you're in the nurse's station and near the sink, you can wash them and get that going. And the first thing you'll do is put on your gown. This will be a new clean gown because we're not going to reuse them. And then Mission Linens is the one that will be laundering them and bringing them back for us. And they are fluid resistant. They do have ties, they don't have to go over your head. So you would put the gown on first and then tie it around the back of your neck with the bow so you can get out of it decently. And that takes just a few minutes. You want to make sure that the cuffs are all the way down on your hands to make sure you're good and covered. And then it has ties. These are big, so nice ties to go around your waist as well. Okay. So my hands are still clean, and I have my face shield on, face mask on that I've been wearing around the unit. I'm going to take that off now because I want to put on my N95 mask. And I will put it in my personal protective storage unit and replacing it and putting it in place of my N95 with the front of it to the front so that the contaminated portion always faces the front. Then you would take your N95 and you would hook it at your chin and pull the loop over, or if it's the kind that have the ear loops, which is also a kind that I have, you would just put it over your ears. Make sure one's at the top of your head and one's at the bottom. You're not supposed to cross them and back. I've seen people do that. Then you want to make sure you bend the nose piece around your nose and they'll do a fit check, if you will, and blow out and see if you can feel any air around the edges, and I do not. And then I would take my face shield, which has been cleaned because we're reusing those. I'm going to put that over my head. And make sure that the Velcro is attached firm enough to keep it so it'll protect my eyes from any splatters or droplets of stuff. We do have the really long ones that have an elastic band, and those are the ones that were mostly assigned to staff, so they will fit on our bags. They just hit the bottom, and then you can spray and clean them when you take them off. Okay, so I've got my face shield on and my N95. I've got my gowns on. I would use hand sanitizer one more time just to make sure. And then I put my gloves on. You want to make sure when you put your gloves on that you have the right size and that they come up over the cuff of your gown. So you pull them up over the cuff of your gown. Now there's talk of a glove shortage. That's why I'm not training on doing double gloving. Although that could be something that you do if you feel more comfortable with it. But you know, I'm not training on that. There, so I'm all ready now. My gloves are over the cuff of my gown. I've got my N95, I've got my face shield on, and now I can go in to the observation hallway and take care of the member. When I go in there, we should have a little cart that's available to you with a workspace and bins underneath it to store and or throw away the used PPE. So I would take my handy dandy little high-tech storage unit with me. I would go in and take care of the member, do what I need to do, assessments, vital signs, giving them meals and spending a little bit of time with them, doing procedures like blood draws and injections and that kind of stuff, you would need to be in full PPE to go in there and take care of that COVID positive person. So now I'm all done. I go step out of the member's room, step out of the room, if you will, into that hall or ante area. It's not really an ante area, but an ante area. And then what I would do first is remove my gloves, and I want to do that in a way that I don't contaminate my hands too much. So I want to take it off and then go underneath and take it off inside itself. And then I would throw them away in the trash receptacle. And then I would take off my gown, again untying, and knowing that I may be touching contaminated or exposed material, untie the back, and then I would pull the gown off and have the inside of it inside itself, if you will. So I don't want to touch the outside, you can touch the inside. Just kind of wad it up and roll it up with it inside itself, and then it would go in the laundry receptacle. The laundry receptacle will have white bags to go back to mission linen. So I put it in my laundry receptacle. Don't have one right here. And then I would take off my face shield, and I would either clean it with the Sani wipe or Clorox wipe, or I would just spray the Sani tin on it and let it dry. Go ahead and clean it real quick. You want to rub all the area that may have been exposed and get it cleaned off. Or spraying with Sani tin is fine. If you hang it on your bag, it will dry and have a place where it can dry. Then I would take my face mask off, again not touching the front. I would do the top one, or the around my neck, and then the bottom one, not touching the front. Take my face shield, my face mask, my surgical one off, and put this back on. Now the one thing that I didn't mention that I would think that we would want to do is before exchanging the surgical mask for my N95 after taking care of the COVID positive patient, I would keep my face mask on, my N95 on, leave the ante area, and then exchange them out. So that I take the N95 off and I put on my surgical mask. I would then use hand sanitizer again just as soon as I could. Wash my hands up really good, 20 seconds of washing your hands. Making sure that you get hand sanitizer on all areas of your hands. And then you would take this, take it out and store it where we can find a place to store it, and then have it available to use again if you needed to. When there is a COVID positive patient on the unit and we're having to take care of them, we're having to go in and give them meals and stuff, there should be only one tech and one nurse assigned to that person. So there's not 3 or 4 people going in there each shift. And we should know who that is. I think that's it. If you have any questions, let me know, and hopefully this works well and I can watch everybody demonstrate it. Thank you.